Hello everyone, this is Chadi Alraies from SCAI-TV in Atlanta. I'm really privileged today to be with Dr. Irfan Shafi from West End University Digital Medical Center to talk about one of his study that he presented at SCAI-TV. Irfan, thanks for being with us.
Thank you, Dr. Alraies. It's a pleasure.
Yeah. So you presented a project about readmission rate for patient in TAVR. Can you please educate about this study?
Yeah, so the aim of this project was to basically look at predictors of cardiogenic shock in patients who underwent TAVR. So we looked at index admissions for TAVR in one of the largest databases in the US, which is the National Readmission Database. This is a observational study, so the data is collected retrospectively, but it represents the entire US population because it's collected from 28 different states. So it's a good representation of how the real world data looks like. So we almost had 48,000 patients who underwent TAVR between 2016 and 2017. And then within that patient population, we looked at basically how many patients developed cardiogenic shock during that admission, and it was significant at 1.84%, around 800 patients. So we had a good sample size, and then what we did is we looked at the predictors of cardiogenic shock in this patient, because we know for a fact that patients with who undergo these kind of invasive procedures, their mortality is high if they have cardiogenic shock. And we saw that. So the mortality in patients who had cardiogenic shock, underwent TAVR, was 20 times higher than patients who had TAVR and didn't develop cardiogenic shock.
And most likely these are a salvage procedure and patient coming with shock.
Exactly. So what we initially did is we looked at the baseline characteristics. The mean age in our patient population, as expected, was mostly elderly patients above age 65. We had a good representation of female patients as well. Around 45% of the patients in the data set were female. And the comorbidities were almost like equally divided between cardiogenic shock and non-cardiogenic shock patients. With that good sample size and good numbers, we used univariate analysis to look for different predictors of cardiogenic shock, and then we used multivariable logistic regression to look at the independent predictors of cardiogenic shock in patients who underwent TAVR. And results were very significant. Most striking results were that patients who developed AKI during that admission were more likely to have cardiogenic shock post-TAVR, which is very significant finding and very important finding for us to note, because we can limit ourselves in giving the contrast in patients who we know are at risk for developing cardiogenic shock in TAVR. Similar results, higher odds of developing cardiogenic shock if you developed acute MI during the same admission. And we know for a fact that patients who have severe aortic stenosis, they already have sort of a low coronary flow because of reduced cardiac output. So when we implant the TAVR, that time there is a possibility that the flow would be further reduced into the coronaries. So that is something to be kept in mind. Then the other predictors were like if patient had history of HOCM. And we know for a fact that HOCM patients, they already have this sort of a dynamic gradient in the alveolar outflow tract, and it can actually worsen if you remove that exactly. So yeah, so when we saw that in our data set, that patients with HOCM actually had higher risk of having cardiogenic shock. What was surprising was female patients had less likelihood of developing cardiogenic shock. Actually, they had 18% less chances of having cardiogenic shock. And this again, when I further digged into literature, it seems like because of the size of the aortic diameter, and it being smaller in females, so they have less chance of perivalvular leak, and then females tend to have lesser comorbidities, like they are not more likely to have cardiomyopathy. They present early with aortic sclerosis and aortic stenosis. So all those factors, I think, when you think about, it seems like females are less likely to have cardiogenic shock if they undergo TAVR. Other factors were like if they develop AFib or had a pacemaker placement during that admission.
So it's a great study, kind of illustrating especially the predictors, kind of to keep the operator keep in mind before operating on these patients. Exactly. As you said, the CKD or AKI, and patients who are already having heart failure or CAD before. Dr. Shafi, thanks so much for your time. Congratulations for a well-done study at SCAI-TV. Please watch these videos and others on SCAI-TV. This is Chadi Alraies from SCAI-TV in Atlanta. Thank you.
Thank you, Dr.